Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking with Mr. John Boyle. He's joining us here as a patient who's received many plasma donations in his lifetime. He's joining us to share his journey with plasma donations, talk about the dire need for plasma donations, especially since the COVID-19 pandemic has caused a sharp decrease in plasma donations, leaving many patients who are immunodeficient compromised. Welcome to Health Professional Radio, John. Thank you so much for joining us and telling us your story.
Well, thanks so much for having me, Neil.
What is it that you do? What is a little bit of your professional background, if you would?
Well, I am a person who's worked in the nonprofit sector for most of my career, and a lot of that was influenced by the fact that I grew up with a rare disease, which required me to get plasma donations, and so I really learned about the impact that people can have upon the healthcare space and the impact that nonprofits often can have when trying to confront a problem like the issue that we now face with a shortage of plasma donations.
Now, you say that you grew up with a rare disease. First of all, what is this rare condition that you grew up with, and exactly how early were you diagnosed with the condition?
Well, I was diagnosed when I was 6 months old with what's known as a primary immune deficiency disorder, a essentially condition that's genetic that leaves me genetically unable to produce antibodies. So it appeared to be a healthy child, but then I came down with a very advanced form of pneumonia. The doctors realized I had an incomplete immune system and would never be able to function, properly without assistance. And happily, there was a therapy that was available, basically donated antibodies that come from human plasma. So since I was 6 months old, my life has really been dependent upon these donations of plasma that are turned into medicine for me, people like me, and tens and tens of thousands of others.
My experience and knowledge of plasma, I'm sure, is rudimentary compared to yours, but it's my understanding that there are centers set up all over and people go in and they donate plasma, but based on the conditions that we find ourselves in with this COVID-19 pandemic, has that personal showing up to these centers drastically decreased?
Unfortunately, there has been a really significant decrease in plasma donations. There was about a 20% drop last year, really across the entire country, primarily because, as people were locked down, as people were not vaccinated and not really going out, they weren't willing to go out to these plasma centers the way that they typically do. And so we've never, in my 4 decades, of receiving plasma-based therapies that come from donations, we've never seen a drop that is anywhere like this. So this is unprecedented, and it's scary for people like us because, there is no other therapy. We do require plasma either for our quality of life or just plain for our lives.
You receive plasma monthly, is that correct?
Well, some members of our community do it monthly. I actually do mine weekly. There's a couple of different ways that you can take this medicine. So once a week, I get mine, and I actually did it just last Sunday while my wife was actually donating plasma at one of the centers that's not too far from us. And there are about over 800 of these centers around the country, so many communities have one near them.
What about the fear of contaminated plasma as far as COVID-19 is concerned? I mean, obviously there are very, very stringent safety protocols in place for donations, but how much of this decrease would you blame on just fear of not just COVID-19, but of maybe receiving some plasma or getting infected trying to donate plasma?
Well, I'm sure some people have thought about that, but the great thing about and the important thing about these plasma centers is very, very early in the pandemic, they were declared to be, by the federal government, essential services. And so they all basically went through processes that, just like your doctor's office, would essentially ensure that they are safe places to go into, that they were socially distanced, that, everyone had the proper precautions. And so the safety to the donor was really a non-issue. But of course, that fear of just plain going out and doing anything like that became problematic. But to maybe answer another part of your question, those of us who rely on plasma donations actually want people who have had COVID to donate because they have the antibodies to it. And a center won't let you donate if you've just had it or if you have an active infection, but they really actually do want people who have either had COVID or had the vaccine because that in fact, enhances, what it is that people like me rely on. I can't produce my own anti-COVID antibodies, so I'm going to rely on the antibodies of the donors.
Now, there are many other conditions that respond to plasma therapies as well. Cancer, hemophilia, severe burns, and many, many more. So the need for the donations to increase is dire.
Oh, absolutely. I mean, these are therapies that are truly lifesavers. And I mean, there's over 125,000 people in the U.S. alone who, with those different conditions and a host of others, frankly, that do rely on the medicine that is created from the plasma or in some cases from the plasma itself. And, so that is why it is so incredibly important, that the past donors come back to those donor centers, but more than anything, because people have heard the words plasma and antibodies and things like that over this last year plus, everyone wants to inspire new people to go into one of these centers and to just check it out, see if they are eligible to donate, because if you are, you will be saving a life like mine and so many others, but also, you are compensated for your time, which, given that it can take a little while to do a donation, that is, I think, very important.
I understand the need to donate plasma. Walk me briefly through the process.
Sure. Well, basically, these 800 plus centers that are around the country, they look kind of like a big doctor's office or kind of a lab or something like that you might go into. There's a little waiting room area. You go. A lot of people make appointments. You go, you check in. You do a little health screening, and if it's your first time, just like my wife's the other day, you've got to do some kind of extra paperwork and things like that. But then once you're done with that intake process, you basically go to what's kind of like a big recliner, and you kind of lay in it, and then one of the technicians comes and, takes the plasma from you, basically the blood, but then returns the red blood cells. So if you're used to donating blood and you feel tired afterwards, well, that's because they took the red cells too. In donating plasma, you actually get the red cells back. They're only taking that sort of watery, yellowish part of the blood, which is the part that's really most important to people like me. And about, an hour and a half or so, and, you're done in most cases.
How would I find a plasma donation center close to me? How would anyone listening be able to say, go online and get a list of where these plasma centers are located and also find out about their protocols?
Well, there is one website that I happen to like. It's called donatingplasma.org. And there you can find a listing of all the centers, not just in the U.S., but also around the world, as well as a lot of information about donating plasma in general. But of course, once you find a center that's near you, contacting them to find out about just any particular issues that that center might have, for the donation, I think is always really important because you don't want to show up and feel surprised. Give them a call, ask a few questions, and make sure that you feel like you are comfortable going in and then reap the benefits of knowing that you've done something really, really great.
Great. And once again, that website is donatingplasma.org, spelled just like it sounds, donatingplasma.org. John, I appreciate you joining us here on Health Professional Radio this evening. Thank you so much.
Well, thanks for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with John Boyle. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.